Good evening, everybody. I'm Dr. Liz Lister. I'm at the Holtorf Medical Group office in Foster City, California. And again, I apologize for the delay. I really appreciate your patience and sticking with it. And I have some excellent information for you tonight. And if you saw a similar presentation that I did about a year and a half ago, I have added slides to that presentation, and I've tightened it up so that we really focus just on the innovative treatments that we do through our medical group related to weight loss, and also to be able to allow plenty of time for questions and answers. So this is really a favorite topic of mine, and it's really the most rewarding thing to be able to help somebody do is to get to a healthy weight and feel good in their bodies. So my interest in weight loss is completely non-cosmetic. It's from a health standpoint. It's really critical to hormone balance, and also from a sense of well-being standpoint. It is really, I'm not going to say essential, but certainly very helpful to feel good inside our bodies and in order to feel balanced in our lives. So let's go ahead and jump in. And for those of you who are not directly familiar with Holtorf Medical Group, this is really a wonderful summary of what we do. We specialize with innovative ways to treat a variety of things, including chronic illness, using studies, using scientific data, evidence-based, to treat these complex conditions, sometimes including things that some more conventional doctors will tell people either don't exist, or it's their imagination, or they're just drug-seeking or whatever, chronic pain, that type of thing. So that is really among our specialties. And so, like I was saying, we specialize with difficult cases. Patients come from all over the country and even around the world. Currently, my furthest away patient lives in Spain, so it's really, really wonderful work. This is a slide from one of Dr. Holtorf's lectures, and I don't need you to look at the details of it right now. The webinar, by the way, will be posted on our website afterwards, so you'll be able to go back and hear more detail or spend more time on the slides if you'd like afterwards, because I'm going to move kind of quickly because we have a lot to cover. This is just, what I want you to get from this is just what happens over the course of our lifetimes. Hormone levels decline, and we're going to see in a moment what other things develop as we get older. So again, we've got hormone levels such as estrogen, progesterone, testosterone, growth hormone, DHEA, pregnenolone, and melatonin, which is important to sleep. And sleep is crucial to weight management. And as these hormone levels decline, a lot of people find it more difficult to manage their weight as well. So this is a typical health span curve over the lifespan. And, peak energy, vitality is usually considered to be in the 20s and 30s, and then things start to decline, kind of correlates with that decline in hormone levels, and then there's the onset of illness. And conventional medicine is focused on treating illness rather than optimizing health earlier on. I have a friend who was in his 80s who said, if I'd known I was going to live this long, I would have taken better care of myself. And so that's what we're here to help people do. But conventional medicine is focused on treating illness, which extends the period of time that people live with illness. What we're wanting to do and also talking about this evening, and I think weight loss is a crucial part of extending the period of time that we spend feeling well and shortening the time that we spend with illness later in life. So some of the things that we're going to talk about tonight, this is a summary slide, and then we're going to go through the details. The first thing is hormone optimization. which we will not spend all that much time talking about, but that really, I think, is the major emphasis of the work we do at Holtorf Medical Group, which is essential to helping people feel their best. Thyroid dysfunction in particular, if you look at the title, at the topic of each slide, the full name of our company is Holtorf Medical Group, Center for Hormone Imbalance, Hypothyroidism, and Fatigue. And so thyroid dysfunction, of course, is very important. And I would say approximately 100% of the patients that come to see me for weight loss have had one test done to check thyroid function, and usually the TSH test, and they're told that it's normal, and we'll address that in a moment, quote unquote normal. And I will say that I usually start out with a new patient checking an average of about 7 thyroid tests. So we really go into a lot of detail looking for thyroid dysfunction. Also a dysfunctional set point at the level of the brain and being able to achieve and maintain a healthy weight. We'll say more about that in a little bit. Leptin resistance, insulin resistance, I'll talk more about that. And we do use pharmaceutical treatments for our patients. I don't think it's the majority of what we do. However, the majority of what we do is hormone balancing with bioidentical hormones and natural supplements, the nutraceutical approach. However, there are a number of pharmaceuticals that, in particular with weight loss, can be very, very helpful. And when we talk about dietary supplements, we'll address some of the supplements, the nutritional supplements that we use here, as well as meal replacements. So unfortunately, this is the state of things in the U.S. at this point. I've got just a few data slides to show you. Actually, these slides are old. The numbers could be worse at this point, but it really is a very, very significant problem. Of the people that are considered overweight or obese, at least a third of them are currently on a diet at any one time. I wish I could tell you tonight about a magic pill that would solve this problem. I could definitely retire if I could invent that. So in any case, everyone's always looking out for all the things that are available through the internet, through lots of different ways to try to achieve weight loss. Again, these are old slides. If I were able to show it to you as these slides are turning blue and then orange and then red, you can see that the last one I have here for 2006 only has a couple of states showing over 30% obesity. It's way more red, and there are no blue states left. So to show things that they are, and you can see the little funny cartoon of the evolution now, and you know, it doesn't really matter whether the guy at the right side is holding a diet soda or not at this point. Plus, I'm really worried about how hunched over he is. That's from checking his cell phone for text messages all the time. Okay, so this is one of my very favorite cartoons that I got from a set of slides from a lecture of Dr. Holtorf. She is slumped on the ground, and the doctor says, "Hooray, good news, your tests indicate that you're in the normal range." And this is really important, and as I said, we're not going to focus tonight on the hormone balancing, which is in fact the major focus and emphasis of what we do at Holtorf Medical Group. I just want you to remember this slide. I have it framed in my office space where I see my patients because I love helping people realize that no, it's not their imagination, that they've been being told that things were normal for years. Meanwhile, this is often the case. They were barely squeaked into the normal range, the reference range, I should say. So that's very, very important. If you have any of these symptoms, I'm going to bring these up quickly for us. These are all potentially related to thyroid. This is to low thyroid function, I should say. This is a shortened list. It's not a complete list. So again, a lot of people are told that these things are, they just have to do something simple and their problems will go away, whereas actually it's an underlying thyroid, low functioning thyroid levels. Let's see if there's anything else I want to say about that right now. Just give you a moment, take a look over this list. Also, the other thing I wanted to say is that a lot of these symptoms will get treated with medications rather than the doctor getting at the underlying cause. And that's what we want to do, is we want to get at the underlying root cause rather than just treat symptoms. Okay, one more moment of comic relief before we dig into the information I want to present to you tonight. We're telling our kids they're starving in China, eat all your dessert, and in China they're saying, don't eat the whole cake, there are children with diabetes in America. And sadly, that is very, very true, and it's increasing. So I'm going to come back to these in more detail as we go through, and this is just a summary list. So I'll talk about them individually as we go through. One of the topics I want to talk about is leptin. And leptin is a hormone that is released by the gut. It's a major regulator of body weight and metabolism. As weight goes up, under normal circumstances with normal metabolism, leptin is secreted to tell the body to stop storing fat. It actually instructs the body to burn the fat as fuel and not accumulate excess weight. So leptin stimulates metabolism, reduces appetite, and as I said, it signals the body to burn fat. If this leptin signaling is dysfunctional, then it develops into what we call a leptin resistance. And this is a simple thing to check for. It's a matter of one blood test checking a leptin level. And if it is over 12, that signifies a leptin resistance. So the number correlates with the degree of obesity and the difficulty losing weight. The good news, well, I'll just tell you this, then I'll tell you the good news. So the body thinks that it's starving. Appetite increases, metabolism goes down, thyroid metabolism lowers, and instructs the body to continue to store fat, even when there's excess fat. The good news is that whatever a person uses to achieve weight loss brings down the leptin level. That is what I observe when I do follow-up measurements of the leptin level. There are a number of medications that are what we call leptin sensitizers. They work in a variety of ways. This drug is called exenatide or Byetta, as you can see at the top, and this is showing the weight loss compared to placebo. This is another drug. These are injections with a very small needle. However, these two medicines are twice a day, and I don't use them very often. This is the newest medication called Victoza. It is a once-a-day injection, and these medicines are all diabetic medications that have weight loss as a side effect. Victoza is on the verge, they are currently collecting data, they're on the verge of being FDA approved as a weight loss drug. So you'll hear a lot more about it once they achieve that. But they discovered weight loss as a side effect from it very early on, and I've had good results with patients with this medication. The very newest leptin sensitizer, I apologize, it's not a very sharp image here, but the drug is called Bydureon. It is actually Byetta from a couple of slides ago, formulated into a once-a-week depot injection. And there are potential side effects. There are lawyer commercials on TV about this group of medications. However, my clinical experience has been pretty good with it so far. And I do believe that the side effects that the lawyers are looking at are actually based on animal studies and are not really finding these bad side effects in people. One of the ways that these drugs work is they slow down intestinal function, and what that does is it causes people to feel full more quickly. So overall intake of food goes down in essentially every single person who uses any of these medications. So when people really have difficulty controlling their appetite, these medications can be very helpful and can work very well. Side effects, of course, related to that slowdown can be a little bit of nausea, sometimes vomiting, that does tend to clear up. So I've had some good results with these medications. The next area I want to talk about is what I'm referring to as set point malfunction. So the brain has a target weight, and I hear people describe it this way, that no matter what they do, they just can't break below a certain weight. The hypothalamus is an area of the brain that instructs almost the entire hormonal symphony in our bodies. There might be a genetic predisposition. This is, in my mind, it's a little bit controversial. However, it's definitely felt that there's a genetic component to obesity. So things that raise the set point and make the brain have a set point that's at a higher weight for people is aggressive or yo-yo dieting, calorie restriction, which of course can impair thyroid function. There are medications that alter the set point. You can see these are things that work at the level of the brain: antidepressants, anticonvulsants, which are seizure medicines. Sometimes medicines that actually increase insulin secretion. Okay, I'll say more about that if we want to spend more time on details of that. Illnesses can cause a change in set point malfunction, and quote-unquote natural effects of aging. Although, as you saw in that very first slide that I showed, hormone decline is a quote-unquote natural thing that accompanies aging. And while I don't think that we should replace hormones all the way back to the level of a 20-year-old in everyone, if somebody's in their 50s or 60s, it may be a question of optimizing their hormones might mean getting them back to levels that they had in their 40s. These are various solutions, and I'm going to spend just a couple minutes on what's at the bottom here. So, of course, optimizing thyroid function and levels will help with set point malfunction. Consistency in diet and activity. Over-exercising can be as bad as no exercise. It can also be as bad as eating excessively. So also, as we said with the yo-yo dieting, that can cause this. So consistency is going to be really important to long-term weight management. Aggressive management of illnesses, things like chronic fatigue syndrome, fibromyalgia, chronic infections, including Lyme disease, that type of thing, chronic inflammatory states induced by stress, all of those things are very important. Naltrexone is a medicine I'll say a little bit more about in just a moment, and also in combination with Wellbutrin. I'll show a study that looks at that, and it's also in an article called Unique Weight Loss Therapies, which is on the Holtorf Medical Group website. And then I just, again, put in parentheses hormone optimization as being very, very important. Not just thyroid, but other hormones, testosterone for men, estrogen, progesterone for women, and also a little bit of testosterone for women. Testosterone in both men and women helps with muscle building, muscle burns, calories at a higher metabolic rate than other tissues, and that can be very, very helpful in terms of weight loss. Let's just take a moment now and look at naltrexone. Naltrexone is pharmaceutically made, and it is made in higher doses, or high dose I should say, as a medication that blocks opioid receptors, and therefore it is used to help people detox off of narcotic addiction. However, it is now extremely widely used, not by a lot of conventional medical doctors. However, there is abundant data showing effectiveness in immune modulation, and this is called low-dose naltrexone. Very, very helpful in the management of autoimmune conditions. I use it in a wide variety of illnesses with my patients. The dose that was used in a study that showed that it helped with set point adjustment was a little bit higher than what is referred to as low-dose naltrexone. And it's considered that it may work at the level of the hypothalamus, the area of the brain, in terms of a set point for body mass. This is the study that I wanted to show you. This is a combination of a not what we call low-dose naltrexone, a little bit higher dose than that, but not the full dose used for narcotics detox. And it was used in combination with bupropion, which is the generic name for Wellbutrin, the antidepressant that you may have heard of. At this point, Wellbutrin is used for a lot of different things, and some of my patients experience weight loss just with the Wellbutrin. However, this study did use them together, and as you can see, showed a significant weight loss. Another hormone that's, again, this is a hormone, serotonin, that is influenced by Wellbutrin, and this is a study, a little summary of a study that showed that it helps reduce appetite, it reduces cravings, and it can be measured with a blood test, and it can be easily replaced with an oral serotonin medication. There are also nutritional supplements that can improve internal production of serotonin. So it helps with mood and energy, anxiety, as well as helping with things that are going to assist with weight management. On the topic of food cravings, I'm going to show you a variety of things in addition to what we've mentioned, but these are some of the major causes of food cravings: overeating and just simply making poor food choices. There's depression. Dysthymia is a medical word for low mood. Again, we can check serotonin levels and we can treat it. Insulin resistance, leptin resistance. So the body's normal mechanisms of telling cells to metabolize nutrients are not getting through to the cells, and weight accumulates, and it's difficult or impossible to lose. Again, there's the psychology of addiction and the physiology of addiction, where food is used as a drug to self-medicate. And in a lot of cases, this can be caused by hormone imbalance. And another large contributor to this is abnormal balance of natural organisms in the gut. Yeast is present in everybody's intestinal tract. However, if there's yeast overgrowth, this causes this sensation of craving sugar. And then it becomes a vicious cycle because sugar feeds the yeast and maintains that overgrowth. HCG is a pregnancy hormone that's been used for weight loss for over 50 years. I think it's really over 60 years almost, and suppresses appetite, and it directs the body to burn the fat preferentially over muscle. So I usually do recommend to patients we talk about diet and total calorie count Usually when I start out with the patient for weight loss, I measure their metabolism, so I have a guideline of how many calories they need to be below. However, if you look online, you'll see a 500-calorie diet as an HCG diet, and you'll see in Dr. Holtorf's article that he's not necessarily in favor of that low of a diet. I personally am not in favor of that. However, I am the first to acknowledge that I have a number of patients, I have a few patients who have used the 500-calorie HCG diet and swear by it. However, I agree with the way that Dr. Holtorf phrased it in his article, which is that HCG can help with weight loss and that it's not necessary to use a very restrictive diet in order to see those results. And that has been my clinical experience with my patients who've used it. We also have a series of injections called Lipo-B injections. They're a combination of vitamins and amino acids. Again, we're helping all the cells of the body properly metabolize fat and transport nutrients. This is a twice-a-week self-injection. And as with everything we're talking about tonight, none of these things help in isolation, all in combination with eating, making healthy choices regarding food and modifying calorie intake. Not to an extreme, but some modification. Human growth hormone is highest in kids that are growing. Kind of sounds obvious, and it's meant to be. So highest levels peak around ages 12 to 15, and again, as you can see here, it goes down by half every 7 years starting after age 21. So it really can get quite low by the time a person's in their 40s or 50s or further. So replacing human growth hormone is a very simple process. It's unfortunate that HGH gets a bad reputation from athletes who abuse it. They use approximately 20 times appropriate dosing and spend thousands of dollars per month. Appropriate dosing still can be somewhere in the neighborhood of $500 for a month's supply. And so, again, that's unfortunate as well because growth hormone has a lot of benefits to the entire body, essentially very, very low chance of any adverse effects from it. I personally don't feel that there's any health risks with physiologic appropriate dosing of HGH. And a lot of times it really makes all the difference for people in terms of body composition. It improves cardiac markers and insulin sensitivity. This is a graph from one particular study showing to the far right, for women, you see a combination of balancing their hormones with bioidentical hormones in combination with growth hormone, and it's a decrease in body fat percentage. Same for the men in the bottom part, and this has been my clinical experience with men as well, that the combination of growth hormone and testosterone is just an excellent combination. Things just really kick into place in terms of results at the gym, and they're often very, very happy with the combination. In terms of nutraceuticals, I'll run through these a little bit quickly. However, ThyroRx is one in particular when I have patients with low thyroid function. It has an ingredient called forskolin that specifically helps with weight loss, as well as helping thyroid function in the body. This is another supplement. We have actually quite a few. There's a whole section. If you go on the holtorfmed.com site, there's a link to all of our supplements website called holtraceuticals.com. And you can take a look. There's a whole section called weight loss, and you can see there's really a lot more supplements than I have time to talk about tonight. And actually people don't even need to be our patients to be able to try these supplements, but we have very excellent clinical results with a lot of these supplements. This one's called GlucoSX. This one is called Glucarol. There's actually a study that directly head-to-head compares Glucarol to metformin. Metformin is an excellent drug for insulin resistance. It does have a lot of GI side effects, and people do a little better with this supplement compared to that. However, that's just, again, showing the effectiveness of a natural supplement directly compared to a pharmaceutical medication. This is one of our newest supplements called Crave Control. And again, I always encourage my patients, and I encourage you on this webinar, to go to the wholetraceuticals.com site. You can spend time there. You can look at the ingredients. There's so much information on the internet now that I encourage that kind of research. I want to direct your attention to an ingredient that's the second to last one on here. It's called mucuna pruriens. Mucuna pruriens is an herbal ingredient that is almost identical in structure to dopamine. Dopamine is the hormone that's released in our brain when we satisfy a craving. So that, when people say they're addicted to things, what they're actually addicted to is dopamine, because it gives these feelings of relief, and this can be imitated very nicely with this supplement. We actually had a patient here who quit smoking using this supplement. So definitely helpful in terms of controlling cravings and giving energy. Also contains chromium, which helps with fat burning. Meal replacements, I personally think that most trainers and probably most weight loss programs at this point include some use of meal replacements. So PCMR stands for portion-controlled meal replacement. Lots of studies showing them to be effective in helping with weight loss. I personally have used the Take Shape for Life or MetaFast program with patients for, it's been over 5 years, so I have a lot of experience with this program. However, there's lots of meal replacements, bars, shakes. We have one that I don't have a picture of for you tonight called Go Lean Protein. That's also an excellent shake powder to use as a meal replacement. This particular program has a transition phase. So the first phase is low calorie, about 1,000 calories per day. Then there's a transition off of that, and I think that's really important for metabolism. So what we do here that I also, we've talked about these things. What we do is very, very thorough lab assessment, not just regular blood tests, but a lot of non-standard things. For example, checking serotonin, checking leptin. We have a test we run in our offices, which measures the thyroid levels, not just in the blood, but at the level of the tissues. It's a reflex measurement with a computer, and also measuring basal metabolic rate to see what your body is currently doing as far as metabolic rates. And our treatments, as I said, include bioidentical hormones. We want to treat the underlying causes, not just addressing the symptom, but we want to get at the root cause. Supplements that we've talked about, nutritional balancing, gastrointestinal support. Again, we want to reverse this trend, and as I said at the very beginning, this is really important in the context of your health and well-being, not simply a cosmetic goal, but very, very important in terms of hormone balancing. When our bodies carry excess weight, that fat tissue is not just there bothering us and possibly not making us feel good about ourselves, but it's actually participating in the hormonal environment in our bodies. It's contributing to inflammation, and getting to a healthy weight is one of the most important things that we can do to achieve and maintain long-term optimal health, and that is what I wish for all of you. I'm going to stop now, and I'm going to take questions.
We've got lots of great questions for you this evening,
Great.
Dr. Lister. And we're going to start out with a question from a young lady, and she wants to know if using an estradiol patch can cause weight gain.
Okay, that's a great question. I think that, first of all, if I had her here with me in the office, I'd be asking her an hour's worth of questions about a lot of other things. But to answer that in a very isolated way, it depends on if she's having low estrogen symptoms. Generally speaking, my clinical experience is no, that the estrogen patch, which, by the way, I think is an excellent way of doing estrogen replacement, is through the skin. My clinical experience is no, it does not usually cause weight gain.
Okay, great. And I've got another one here. How about a doctor that has joined in on the call would like to know if we use sodium bicarbonate to reduce acidity during weight loss?
That is a very interesting question. I haven't used that particularly. That's a big topic on the internet, and I have received information about alkalinizing water, alkalinizing the body. So that's an excellent question, and I do believe that it's beneficial to alkalinize the pH environment of the body, and there's lots and lots of ways to do that. So I haven't had people do that specifically, but it's definitely a good thing to consider.
Okay. And I've got another young lady who says she's stuck. She's done 3 rounds of HCG about a year ago and has lost a total of 65 pounds, but hasn't lost anything in the past year. And their thyroid levels are monitored and take about 37.5 milligrams of T3, but would like to lose another 30 pounds. Do you have any recommendations?
Okay. Well, it's difficult to get into that level of detail tonight. Again, I would have an hour's worth of questions for her to really answer that question properly. However, let me try and give a simple answer for our purposes tonight. So she's getting thyroid addressed. She's done HCG. By the way, congratulations. That's great. That's very, very good. Well done. So you've had some weight loss, and now it's kind of reached that kind of set point that we were talking about. So that's a possibility. Wellbutrin and naltrexone are a possibility. A meal replacement program also is a possibility. Any kind of structured meal program that can lower total caloric intake. I would tailor it directly to you if I had you here, but those are some general things. In addition to the other things that we looked at here, I always think it's good to use these things in combination.
Okay, and we have several more questions. Here's one. How about, can Lyme disease alter your set point?
Absolutely. One of the many illnesses, infections, inflammatory states that can alter the set point. You bet.
And do you have any recommendations for yeast overgrowth?
Absolutely. We have, again, it depends on the clinical setting and what symptoms a person is having that go along with that. I often recommend paleo way of eating. Another way of saying that is when you're making food choices, to ask yourself if your great-grandma would have recognized it as food. For example, a lot of the processed foods, the way we make bread now, contributes to yeast overgrowth. So lots of things with sugars, even fruits, can contribute to it. But generally speaking, it's the starchy carbs that are the worst offenders, as well as anything that's white flour, white sugar. Those types of starches and carbohydrates. Avoiding those is the first step to lowering the yeast overgrowth.
And another question is, how do you test for magnesium deficiency during weight loss?
I always measure a magnesium level as a baseline, and then I normally go from there symptomatically. Magnesium helps with muscle pain and helps with sleep. It helps with digestion. So I normally monitor symptomatically. However, I do always do initial baseline, and then I check it from time to time.
Okay. And we have a listener that wants to know about if you have any thoughts on the new weight loss drug, Belvig.
Absolutely. And I wish we had Dr. Whiteman. If he's on the line, I wonder if we can get him too. He's our expert.
Yeah.
This is the newest kid on the block. Actually, one of my slides earlier mentioned, it had a brief comment about a combination of Phentermine and Topamax, and that's not the newest kid on the block. The newest one is the Belvig, and the data is excellent. I don't have any clinical experience with it yet. I have not tried it yet, but I will definitely be trying it because the data is good. The side effects seem to be low, and any tool that can help my patients achieve and maintain a healthy weight is a tool that I'm going to include in my toolbox. So those are my comments for now. I will get more information about that, and possibly we'll be able to put something out about that on our newsletter.
Great, and I have a nice big question, kind of open-ended question, but I know a lot of people do deal with this. And this, a listener is saying that they can lose weight, but they just have trouble keeping it off. Any suggestions?
Okay, so again, so first of all, that's good. I'm glad that it's not difficult to lose weight. There's so many things that influence my answer to that question. That's actually a really hard one to answer without knowing a whole lot more detail. I would say consistency, not low. You know, it's actually a common cause of weight gain. The common wisdom of exercising more and eating less actually leads to weight gain a lot of times. So there may be, you know, after this person is achieving weight loss, they might be maybe taking things too far, maybe exercising too intensely, maybe reducing calories too much, and then that's causing hormonal imbalance and leading to regaining weight. That's just a
okay. And we have another listener that wants to know
the answer to that question.
Okay. If you feel that there's any benefits with weight loss with acetyl-L-carnitine.
Like I just said, I am in favor of anything that helps anybody achieve and maintain weight loss, and I do have patients who have told me that acetyl-L-carnitine has helped them with that. For some people, it helps with the fat burning, and again, it's an ingredient in quite a few of our supplements, and so I do think it's helpful. I don't focus on it too much. I tend to focus more on the hormone balancing, but I do think it can be helpful.
Okay. And I think we've got time for one last question.
All right.
And this again was from a doctor that joined our call. And his question is, when a patient is taking thyroid medication and has lost to greater than 50 pounds, and they want to prevent too much more weight loss, how do you determine dosing for thyroid?
Excellent. That's an excellent question. And it's something to keep in mind, not just for thyroid medication, but for other medications. A lot of times people are overweight and they're on blood pressure meds, they're on diabetic meds, and all of those doses have to be usually brought down, including thyroid medication. And so I will go down based on the clinical presentation. So if measuring pulse, symptoms of palpitations, those things are often I've had that experience with patients where those symptoms appear with a significant weight loss, such as losing at least 50 pounds. That's, definitely going to be significant and require dosing adjustments. So I do it clinically. It is my generalized answer.
Well, Dr. Lister, we want to thank you for the presentation this evening. Everyone, Dr. Lister is in our Foster City location. And if you want anybody to be able to share this presentation, we will have it on our website, posted on YouTube by Monday at the latest. And if you would like to schedule an appointment with Dr. Lister, we would be happy to do that. Just call us at Holtorf Medical Group. Dr. Lister, thank you so much.
Thank you, Jenny, as always. And thanks to everybody. Thanks for the wonderful turnout. And we have our Facebook chat tomorrow. I believe we're going to continue the topic. If people think of more questions, join the Facebook chat, and I'll be on for another hour tomorrow just answering questions. No presentation. It's just a chat, just all questions for an hour. It's 12:30 to 1:30 Pacific Standard Time.
We look forward to it. Thanks so much, Dr. Lister.
Thank you, Jenny, very much. Thanks, everyone.
Bye-bye.
Bye-bye.